Hello and welcome to our Advanced Cardiovascular Life Support ACLS training session. Today we are going to focus on the management of asystole, one of the most critical conditions you'll encounter in emergency cardiovascular care. We'll be following the American Heart Association (AHA) 2020 treatment guidelines, which provide a comprehensive framework for managing this condition effectively. My name is AJ, and I'm an ACLS instructor with over 20 years of experience. Let's dive in. Asystole, often referred to as flatline, is a state of no cardiac electrical activity, which means there is no heartbeat, no blood flow, and therefore, no oxygen getting to the body's vital organs. Asystole is a form of cardiac arrest and represents the cessation of electrical and mechanical activity of the heart. When you encounter a patient in cardiac arrest, the primary assessment is your first crucial step. This involves the following components. First, ensure the scene is safe for you and your team. Use personal protective equipment (PPE) as necessary. Secondly, tap the patient and shout to check for responsiveness. Look for any signs of life, such as movement or breathing. Thirdly, call for help or instruct someone else to activate the emergency response system and get an AED, automated external defibrillator. Next, simultaneously check for breathing and a pulse for no more than 10 seconds. If the patient is not breathing or only gasping and you do not feel a pulse, start CPR immediately. Start high-quality CPR with chest compressions at a rate of 100 to 120 compressions per minute and a depth of at least 2 inches, 5 cm in adults, allowing full chest recoil after each compression. Provide rescue breaths at a ratio of 30 compressions to 2 breaths if no advanced airway is in place. Lastly, once the AED arrives, attach the pads and follow the prompts. If the AED advises a shockable rhythm, follow the AED prompts to deliver a shock. If the rhythm is non-shockable, asystole or PE, resume CPR immediately. Once CPR is in progress and you have access to more advanced equipment and personnel, move on to the secondary assessment, which involves a more detailed evaluation and treatment plan. Consider advanced airway placement such as an endotracheal tube or supraglottic airway to secure the airway and provide more effective ventilation. Ensure that the flatline is not due to a loose or disconnected lead and confirm asystole in more than one lead. Gain intravenous (IV) or intraosseous (IO) access to administer medications. The primary medication used in asystole is epinephrine. Administer 1 mg of epinephrine intravenously intraosseous every 3 to 5 minutes during resuscitation. Epinephrine is a vasopressor that increases blood flow to the heart and brain by constricting blood vessels and increasing heart rate and strength of heart contractions. Identify and treat reversible causes, known as the H's and T's: hypoxia, hypovolemia, hydrogen ions, acidosis, hypo/hyperkalemia, hypothermia, tension pneumothorax, tamponade, cardiac, toxins, thrombosis, pulmonary, and thrombosis, coronary. Epinephrine is the cornerstone drug for managing asystole. Its primary action in cardiac arrest is to increase coronary and cerebral perfusion pressure during CPR. This is achieved through its potent vasoconstrictive properties, which help direct blood flow to vital organs. Administer 1 mg intravenously intraosseous every 3 to 5 minutes. Follow each dose with a flush of at least 20 milliliters of IV fluid. Elevate the extremity for 10 to 20 seconds to facilitate the delivery of the drug to the central circulation. While not typically used in asystole, it's worth noting that amiodarone and lidocaine are used in the management of shockable rhythms like ventricular fibrillation and pulseless ventricular tachycardia. Sodium bicarbonate may be used in specific situations to correct severe metabolic acidosis, hyperkalemia, or tricyclic antidepressant overdose, though it is not routinely recommended for cardiac arrest. Initial dose 1 mg/kg intravenous bolus. Repeat doses should be guided by arterial blood gas analysis. Magnesium sulfate is specifically indicated for torsades de pointe, a type of polymorphic ventricular tachycardia associated with a prolonged QT interval. Administer 1 to 2 grams intravenously over 5 to 20 minutes. If return of spontaneous circulation, ROSC, is achieved, Immediate post-cardiac arrest care is crucial for improving the patient's chances of survival and neurological outcome. This includes optimizing hemodynamics and oxygenation, ensuring adequate blood pressure, targeting a mean arterial pressure of 65 mmHg or more, and maintaining oxygen saturation above 94%. Continue advanced airway management and ventilatory support, aiming for normocapnia, a PaCO2 of 35 to 45 mmHg. Perform targeted temperature management to maintain a constant temperature between 32 to 36 degrees Celsius for at least 24 hours in comatose patients after ROSE. Perform immediate coronary angiography in patients with suspected cardiac cause of arrest, especially if ST elevation myocardial infarction is present. Continue to identify and treat underlying causes that may have contributed to the cardiac arrest. In conclusion, managing asystole effectively requires a systematic approach based on the AHA 2020 guidelines. This involves immediate initiation of high-quality CPR, rapid assessment and confirmation of the rhythm, prompt administration of epinephrine, and addressing reversible causes. Remember, teamwork and communication are essential throughout the resuscitation process. Thank you for watching. I hope this video has provided you with a clear understanding of the management of asystole. Stay tuned for more in-depth videos on other aspects of ACLS. Don't forget to like, subscribe, and hit the notification bell to stay updated on our latest content. Stay safe and keep learning. See you in the next video. Before we wrap up, we'd like to introduce you to One Call CPR, located in Dallas, Texas. If you're looking to get certified in American Heart Association, BLS, ACLS, or PALS courses, One Call CPR offers comprehensive training to help you achieve your goals. Their expert instructors provide hands-on learning experiences to ensure you're well prepared for real-life situations. For more information and to schedule a class, visit www.onecallcpr.com. Investing in quality training can make all the difference in emergency situations. Stay prepared, stay confident, and take the next step in your resuscitation education with One Call CPR. Thank you for watching, and we'll see you in the next video.